Hi, I'm Adam Abrish, cyber risk practice leader for the Signature B&B companies. And today we're going to be talking a little bit about cyber risks and how some of the small things that you do every day in your medical practice can affect your bottom line in a big way. Something that I speak with a lot, I meet a lot of the time with practice administrators as well as physicians. And so the concerns with the physicians and practice administrators kind of line up. And we talk about healthcare data and PHI and why it's so important to protect it. Cyber criminals are specifically targeting the healthcare industry because healthcare information is up to 10 times more valuable than, say, payment card industry. Now, why is that? Right? Because cyber criminals can take this health information, right? So you're talking about names, addresses, social security numbers, medical history, and you're also talking about billing information, right? These cyber criminals take this information and they can use it to create fraudulent claims, right? And process fraudulent transactions. So what they're doing is they're creating almost an alternate medical history for you in a certain way. And your social security number, your name, your address, these are things that, by and large are difficult to change. Not like a credit card number where you can change it instantly, right? So when we're thinking about that, the healthcare industry is specifically at risk, which sets it apart from some of the other businesses that are out there. Now, as a practice administrator or physician, anybody who works in a doctor's office, right? Every day you're dealing with patient information. And it's important to keep in mind that there's a lot of different ways that information gets transmitted, right? When you think about it, it could be doctor to doctor, where there's one specialist who's working with a general practitioner, or vice versa. There's also doctors communicating with office and support staff, right? So what are the mediums that we're transmitting information through, right? Could be email, could be text, could be verbal, could be voicemails, right? All of these different, stations for data are potentially at risk, right? Because the healthcare information is at risk while it's on your systems, say in the office, while it's in transit, that's the emails, the texts, the faxes, and then finally when it rests on someone else's systems, right? So a lot of people, I hear them say, oh, we outsource that to a third party, or we use a third party to handle that. So it's important to understand that data regulations apply to the owner and the collector of information. And you can't transfer that liability via contract. So if you're that doctor's office, if you're that facility, healthcare facility, if you're the practice administrator, the buck stops with you. Once a patient comes in and gives you that information, it's your responsibility to take all the reasonable precautions you can to protect that, right? And there's a lot of different ways that these breaches occur, right? So it's important to keep in mind that you have three main threat factors. You have outside attackers, you have insider threats, and then you have third-party incidents. So the outside attacks, which you're reading about every single day, right? These are your hackers, right? Just saw a huge breach at Equifax. You read about malware, malicious software, ransomware, spyware. Right? These are the attacks that you read about commonly, and they're targeting healthcare facilities, they're targeting retail risks, but the healthcare industry in particular is being targeted by hackers. So what does this mean for a healthcare facility? What does this mean for a practice administrator? Now, everybody's familiar with HIPAA and the guidelines surrounding HIPAA, right? So we do everything we can to be HIPAA compliant, but in addition to the outside attackers, you also need to look at the insider threats, your employees, right? What are you doing to protect information? Is the access to information protected, right? What do you do to vet your employees? We saw a case overseas with a healthcare company called Bupa, and this company actually had an employee who took the job, and her entire modus operandi behind taking the job was to gain access to healthcare information and steal it and sell it, right? So practice administrators and doctors alike need to think about their staff internally, right? Now, it's not always necessarily malicious, but what about somebody who loses a laptop or loses a phone, and all that sensitive healthcare information is now essentially out in the wilderness for those cyber thieves, right? So it's not always necessarily a malicious insider. It could just be, a negligence sort of thing. And that's where best practices really come into effect. What I mentioned earlier, the third-party incidents, right? Think about all the different vendors that you use and the ways in which information is transferred, right? You have ERM, you have all different, or EMR, I should say, where emergency medical records are transmitted, stored, they're sent between certain doctors back and forth. And you think about all these different communications, and it's great that everything's connected, but it also presents a risk for your patients and your practice. So it's important to take this into account when you're dealing with any kind of health information. So I talked a lot about data and data protection in practices. Now, what does that mean day to day, right? Let's take a common example. A lot of times in your practice, you're faxing certain items, right? You're sending things back and forth, and what's happening is your fax machine is scanning that document, storing that information for a period of time, and then ultimately sending that out. Now, if you have an all-in-one office machine, a lot of practices do, what's happening is that cache of data is being stored within there. Now, a lot of the times, these are expensive machines, you end up renting them from somewhere, and you change vendors. This is a real-life example of this happening. There's a healthcare practice who used an all-in-one machine. They decided to change their vendor from the all-in-one machine, and they sent their fax copy scan machine back. So what happened was, a few weeks later, they received a notice because that fax scan copy machine was then sent out to another company who realized that all of the documents that healthcare practice had been scanning, faxing, copying over the past 3-4 years were all stored within their machine, and they, a completely unrelated entity, could access all of these health records. This was a huge, huge claim, both from a first-party standpoint, a third-party standpoint from claims coming in from patients, and then finally a massive HIPAA fine. So there's a lot of different ways that simple everyday tasks can lead up to big dollar signs for the practice. So 93% of all organizations are compromised within minutes. So you need a team that's able to respond as fast as you find out about a breach. And that's going to involve the legal team coming in. You're going to need a breach coach that's going to quarterback your efforts. Then you're going to need the forensics team to figure out what's happening. Is it still happening? What do we do now? Right? That's before anything happens. And also PR involvement. You want to make sure that you have a good public relations team together, because you're going to need to communicate what's happening with this breach to the people who are affected. That's before any of the notifications come down the line. You need to have a breach response team in place, and you need to have a process by which your entire administration and your entire practice is able to respond quickly and effectively, and then also have the risk transfer in place so that with one phone call, you're taking that responsibility and you're putting it in the hands of experts that have done this thousands of times.